Hi, this is Alexa Doris. Today I'm going to teach you how to give an extraoral exam. These exams will typically be given to patients before they go through a dental exam. These are necessary to make sure that the patient doesn't have any irregularities outside of the mouth. It's important to make sure that you maintain aseptic technique, which means you keep everything sterile and you use the proper equipment. In typical conditions, this examination would take place in the dental office. The hygienist would have on gloves, a mask if they are sick or if the patient is sick, and there will be adequate lighting to make sure that they can see any lesions or blemishes or discolorations. When giving the extraoral exam, you want to make sure that your patient is sitting in an upright position. This is my patient Kristen. Today I will be giving her the extraoral exam. Before I gave the exam, I would explain to her what an extraoral exam is. The step I would do is inspect her face for symmetry to make sure that if there is a blemish or a lesion or any discoloration, that it is on both sides of the face and not just one. I would inspect for discoloration, any cuts or blemishes on her face, and if I would find any, I would ask her if she knows that they are there. The next step is to inspect and palpate the neck by lifting her chin and palpating down her trachea. And I would feel to see if anything is enlarged or irregular. The next step I would do is palpate her thyroid gland. The next step is to place your hand over their throat and ask them to swallow. You would feel to make sure that there is nothing blocking her throat, that everything can go down nice and smooth. The next step of the extraoral exam is to palpate the patient's lymph nodes. Lymph nodes are in many places of your head and neck. They drain the fluids of your body to make sure that there is no infection. If there is infection, that is why your lymph nodes typically swell. If the lymph node is only swollen on one side, that is a cause for concern. Then you would document it and refer them to a doctor. First nodes I'm going to palpate are her preauricular nodes. These are located in front of the ears, and I would just take both of my hands with 2 fingers and feel for any enlarged nodes. The next nodes are the postauricular, which are behind the ears. Next nodes, since I am back at the postauricular, I'm going to do her occipital nodes. These nodes go down the hairline and to the base of her skull. Next, I would turn my patient's head to the side and have her tilt back. Doing this motion would make her sternocleidomastoid muscle protrude. The reason I do that is because her cervical nodes are down her sternocleidomastoid muscle. So I would start up by her ear at the top of the muscle, and I would palpate all the way down until I reach almost her clavicle. The next nodes are the submental and the submandibular nodes. These nodes are located under your chin, back your jaw, all the way back to the angle of your mandible. I would start right under her chin, and this are the submental nodes. I would palpate around the bottom of her chin and move back until about halfway down the mandible, and then these are where your submandibular nodes begin. The next step is to palpate and examine the temporomandibular joint. Your temporomandibular joint is what makes your mandible move up and down and side to side. I'm going to give a little bit of pressure, and I'm going to ask her to open and close. And open and close. And I'm going to ask her to move her jaw laterally side to side. Now when I'm doing that, I am feeling for crepitus. And crepitus is the cracking or popping of bones. If I feel that, I would ask her if she has any problems when she chews or when she talks, if her jaw cracks or locks a lot. If everything on the patient was regular, like it was with Kristen, you can continue with the dental examination. Before doing any of these examinations, you want to make sure that you have gone thoroughly over the patient's health records and medical history to see if there are any problems that you can look for while doing the examination.